bother you, but you're here and you're ready for your medical exam, correct? Good. No need to sit up, just keep sitting right back in that medical chair right there, and I'll be the one sitting in the chair in front of you, okay? Hi. Hands all sanitized. You're here for a in-bed exam. Please don't sit up, okay? You can keep relaxing. And I'm just going to perform a head-to-toe nurse exam for you today, okay? Good. I'm Nurse CC. Are you okay with me being in charge of your care today? If not, we've got about 7 other nurses, and I'm sure one of them you'll like. You're okay with me? Okay. If at any point that changes, let me know. Everything is fair in my game. Okay. I'm gonna quickly check you on in. It looks like you've been having trouble sleeping well throughout the night, and the doctor prescribed you to stay here overnight so we can watch you, correct? Good. So, quick question, name and last name. Do you spell that with an I-E or a Y? Good. Birthday with the year. Are you a Scorpio? Fabulous. I'm sometimes right with that and sometimes wrong. Okay. And before we begin the exam, do you have any allergies I should know of? Because I want to make sure your care is top tier. Okay, so none of that. Okay, before I examine you, let me quickly tell you what we're going to do. We're going to give you a head-to-toe exam. Have you ever had that before? I'll quickly show you. So, this procedure is very simple. A lot of people find it relaxing, as I still want you to lay in the bed during this exam. No need to get up. Okay. We're just going to be checking all aspects of your body and medical performance. Head to toe. That includes your eyes, your nose, the function of your muscles, your ears, your hands, your arms, your legs, your lungs, etc. Is that okay with you? Just basic care. Okay. Let me get some gloves on and let's begin. Thank you. So, it looks like you may have also bumped your head trying to get to sleep. I noticed it right there in the top corner. Okay. I'm going to be a little bit more quiet during this exam again because it is so late. So, pardon me for being a bit quiet. A lot of people find the nighttime exams to be very relaxing, so just lay in bed. If you need a blanket or anything, let me know. I'm going to begin by looking into your eyes, and I'm going to ask you a couple of questions, okay? Okay. Are you able to look at that light for me? Good. Try not to get distracted by my hands. We're just going to grab your vitals, and I'm checking to see first that your pupils are dilating correctly, okay? Does that light bother you at all? Is it too bright? Just keep looking at it until I say stop, okay? And then we're going to move on to getting your heartbeat. Okay, thank you. Can you quickly say off for me? I'm going to just ask you to do a set of things, okay? Okay, have your teeth been bothering you at all? Okay, get your heartbeat. This may be a bit cold, I apologize. So, I'm going to place it on each side of the chest, and I'll let you know when to breathe in and breathe out, okay? Breathe in. Breathe out. Good. Breathe in. Breathe out. Okay. Move that to the center now, right there. Breathe in. Breathe out. headaches or trouble falling asleep due to acid reflux? Okay. I'm just gonna listen to the stomach now, okay? That sounds great. I'm going to reach just around the side of your shoulder to listen to your back. And I'm going to listen to your lungs. Do you have any lung issues I should know of, like asthma, or maybe do you take an inhaler for whatever reason? Okay. Let's see, reach right all the way, and let's listen carefully, okay? Breathe in. Breathe out. Good. Breathe in. Good. Breathe out. Good. Breathe in. Okay, and breathe out. Good. So, I'm going to put this little button on your finger, and it's going to measure your oxygen level. And then I'm just going to quickly get your blood pressure, okay? Can you give me one of your hands? It doesn't matter which. Let's see. Oh my goodness, you have beautiful fingernails. Let's just clip that on and we'll hold it for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Let's see. Pulse oxygen level at a 98% for oxygen SpO2, and your BPM stands at around 84 beats per minute, which is perfectly fine. Okay. Now we're going to get the cuff onto your arm to get your blood pressure. Okay. So, I'm going to place this around your arm, and I'm going to listen carefully. Just give me one of your arms. Good. And let's place this around. Right there onto this arm. Okay. And just relax. And let's listen carefully. Good. Let me know if you feel any pain from this, okay? Good. You're doing great. Good job. And 1, 2. Okay, good. Good blood pressure. Let's take that off. Good. Let's remove that from your arm now. We're looking at 120/80, which is perfect. You did great. Let's write that down, 120/80, which would also be 84. Okay, the results look good. I'm gonna quickly check your eyes now, just a bit up close, if that's okay with you. So, sometimes when you are unable to sleep, your eyes can get really frustrated and stop focusing correctly, okay? So I'm gonna cover one of your eyes. Can you let me know when you see the light in your eye? There. Good. Here. No. There. Good. Here. No. There. Good job. And here, can you see the light? And what about there? Okay. Quick question. Let me cover your So just turning the brightness off on your phone or tablet or television, okay? Good, thank you for listening. So, I'm going to give you a color test here. Are you someone who's color partial or unable to see colors? I always do this because sometimes if you're absolutely tired, you can get the colors incorrect. What I want you to do is just try your best, and even if you're unable to see colors, take a guess what the color is, okay? Okay, let's start. I have my panel here. And what does this one do to your vision? Can you let me know? Everything is green, kind of blue. Okay. And do I look green or blue? I do. Okay, good. Good job. What about this panel here? What does this one do to your eyes? Everything is pink. Very good. And can you tell me what color is my nurse outfit here? It's blue. What about my gloves? Blue or purple? Okay, good. You're doing great. What about this panel? What does this panel do? Everything is blue. Okay, quick question. I do have a candle back there. What color is the candle? Kind of like a yellow or a green. Good job. Okay, 2 panels left. You're almost done here, don't worry. What color does this panel make everything? Purple. Okay, and what color is my scrub? Blue. What about my glove? Blue. Good job. And last one here, which I'm going to pull a test on with. What color is this panel? This one is the most obvious. This one is red. Very good. Quick question here. What color are my scrubs? They're like a dark purple or blue. And what about my glove? Same. I'm going to give you a red light panel test. And what I want you to do is let me know what color is the light. Is it white in the center and red on the rays? It is. Okay, and what if I move the light all the way back? Is the light white at the center but red on the rays of light that shine from it? Good. And what about this direction? The same. Here. The same. And what about down there? The same. Okay, looks like your red light infraction test is doing splendid. Good job. So, it looks like your eyes have not been affected by the lack of sleepiness, which is perfectly okay in my book. I'm okay with that. I like to hear good news. Okay, next I am going to test your sense of musculature by tapping on muscles around the face. Okay? All I want you to do is let me know if you can feel it. So I'll ask you here, and you say yes or no. Are you ready? Let's start all the way at the scalp. Here. Okay, and here. Here. On the eyebrow. Here. 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 Okay, and let's start right at the side of the neck. Here. Triceps here. Here. Good, and what about there? Here. 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 Okay, give me your arms. I'm going to test the reflex muscle right at the center of the arm and right at the wrist. Good musculature. Could you feel that? And then the hand. Good musculature. Other arm. Here. Good musculature. Could you feel that? Good. Let's test the knees. Just keep laying down. I'm going to just see if your knee muscle works. Good. Good. And now the ankle. Good. Good. Okay, moving all the way forward now. I'm going to test right behind the ears. Can you hear this over here? Good. And what about over there? Good. Musculature seems to work. Okay, you're doing great. Now what I'm going to ask you to do is just a quick hearing test, nothing too strenuous or wild. I have these tools here. They are known as tuning forks. I only have 2 or 3 of them with me right now. And I want you to let me know if you can hear them. As simple as that. This one is a C sharp. Let me know if you can hear it, or when you can. Could you hear that? I'll do it again. Could you hear that? Great. Okay. The next one we have here is, I think this one is a B. That one sounds great. Can you hear this? I'll try again, okay? Could you hear that? Good. And last one here. This one is the largest of the tuning forks, but this one is the hardest to hear. It's okay if you say you can't hear it, because I can't either. Yeah, can't hear that at all. Let's try. Can you hear that at all? Not really. Let's try it again. Let me know if you can hear this. And what do you think? Not so much. That is A-okay. Okay. I'm going to give you a very quick smell test and a taste test, and I'll let you be on your way, okay? I have 2 essential oils here, and I need you to identify the difference between the 2. Okay. So, perfect. 2 here, and they're very interesting. You won't be able to see the label, so you can keep your eyes open if you'd like. But let me know what you think this essential oil is. But put that right under your nose and just explain what you think you smell, okay? You're doing great. This one smells like citrus, like a lemon. Very good, you're close. A bit like fruit. Very good, I agree. Okay. And it looks like it also smells like orange. Well, you'd be correct. Good job. One more here. This one is a bit more interesting. Okay. I love the smell of this one. It's under your nose now. Please breathe in. And breathe out. What is this one? It smells like flowers. It smells like a spa. It smells floral and earthy. I think you've got this. Any guesses to what exactly it is? Because flowers was correct. This one is lavender. Great job. And we're going to give you one final test here. I have 2 taste tests here. One of them is strawberry, and one of them is blueberry. I'm going to shuffle them below, and I want you to identify which one you think it is, strawberry or blueberry, okay? So I've chosen one at random. Say ah. We're going to drop 3 drops. And what do you think this one is? Just taste. Good. Did you get blueberry? Because it was blueberry. Good job. Okay. So we're going to rerun the analysis on you now, and we'll recheck you again in the morning for your lack of sleep. But what we were doing is we were studying your ability of your cranial nerve and basic health functions with the head-to-toe exam to see what could be impacting your sleep, okay? Okay. I will let you rest now, but I will recheck you in the morning, as I will be working all night long, okay? If you need anything, hit the button next to you on the right, and we can get you pillows, blankets, and we do have snacks, okay? Just let me know, and we're going to reassess you in the morning to see how we can fix your sleep, okay? The doctor will be in the morning as well. Okay. Have a great night. Thank you for being so patient with